Well, there's a couple different things that we looked at with this report. One is total mortality, or the total number of people that died in Pima County in calendar year 2020. That did increase 26% in comparison with the average of the previous 3 years. Likely, a large portion of that could be attributed to COVID-related deaths. Certainly, everyone's aware that the pandemic began, towards the beginning of 2020, and we had excess deaths because of it. And then when you look at the actual deaths that we certified at the medical examiner's office, the big changes or increases that we had were with overdose deaths, where we had um, a large increase in the number of overdose deaths, particularly attributed to fentanyl.
What are some of the trends that you observed when you were looking at those numbers and found that fentanyl was one of the factors that continues in this community?
Well, it's really kind of striking because if we go back to 2014, which wasn't that long ago, we had 5 overdose deaths in 2014 where we felt that fentanyl was a contributor to the death, in contrast to 208 in calendar year 2020. That's a 4,000% increase just in fentanyl. And then number two is a significant increase also in methamphetamine. Not quite as bad as fentanyl, but that was a significant factor as well.
A 4,000% increase, is that correct?
That's correct.
What sort of strain does that put on your office?
Well, I mean, there was um, there was 446 overdoses in 2020. Certainly, that's more than one a day. Overdose deaths. You have to send toxicology testing to a lab, and you also have to do, a full postmortem examination to look for other potential contributing causes of death prior to getting that toxicology testing back. So it does increase the workload quite a bit to investigate those kinds of deaths.
Are these individuals who are using opiates and they're laced with fentanyl? I mean, they're not assuming that it's going to be as toxic as it becomes.
It's probably a mixture of both. So there may be those individuals that are seeking, the next best high, and they hear about, a super drug like fentanyl, and people want to try it for curiosity's sake. And then, of course, there's others where they may be purchasing a substance that has fentanyl in it, and they don't know it. Clearly, there's no ingredient list, when you purchase drugs, or you think it's something else, and that I'm sure happens too.
Can you tell us a bit about the demographics that you're seeing? And I assume that they're not necessarily new. You've continued to see younger males between certain age groups that are affected.
Yeah, so for overdoses, at least in 2020, is really 20 to 39. So that demographic in terms of age um, was the lion's share of overdoses, and it's about a 70% to 30% male to female ratio for overdoses in 2020.
As you look toward the future, I know you can't predict what happens in the next year, but are you already seeing that the trends will continue in Pima County?
Yeah, it really hasn't slowed down. I mean, we haven't done in-depth some kind of statistical analysis for the first 3 months of 2021 yet, but at least subjectively, it does not appear to have slowed.
This may be out of your realm, but as you look at this issue continuing in this county, what do you hope? What sorts of conversations need to take place to get in front of this problem?
Well, we work with public health and people that are interested in substance use disorders and try to get the information out and available to them. And then really they're the ones that come up with what to do, with that information and what type of messaging to get to what groups with the intent to try to prevent, future overdoses.
All right. Dr. Gregory House, the Chief Medical Examiner in Pima County. Thank you.
Thank you.